Alright guys, so the other day you saw me record a video on using an elliptical trainer. This is another piece of equipment we have here in the clinic. It's called an arc trainer. It's produced by Cybex. This is probably my personal favorite out of all the different kinds of devices. The reason why it's called an arc trainer instead of an elliptical, so the elliptical, your feet are actually moving in an ellipse. In an arc trainer, your feet are arcing front to back. They've removed the back end of the ellipse. Now, there's pros and cons to every piece of equipment. No piece of equipment is perfect. No piece of equipment is, a one-size-fits-all. But I'm going to talk about the arc trainer. What I like about the arc trainer the most is that there is more of a vertical component. And when we're looking at post-operative reconditioning, increasing strength, increasing endurance, increasing overall health, cardiorespiratory health, the arc trainer is a great option. Not the only one. And if somebody is going back to a gym or a fitness facility, I always explain, we want variety of movement. So if you want to get 30 minutes of cardio in, because you've been told and believe that 30 minutes is ideal for you at this stage, I would love to see you do 10 minutes on one piece of equipment, 10 minutes on another, 10 minutes on another. Might be a rower, an arc trainer, an elliptical. The next day it might be a recumbent bike, it might be a treadmill, a Stairmaster. There's just so many things that you can do. We want to bring variety into your fitness diet. So, benefits of the arc trainer specifically. If you can see the foot plates, just like on the elliptical, the foot plates will move in a reciprocal pattern back and forth. If one foot plate goes forward 6 inches, the other foot plate will go back 6 inches. The benefit to that is that you're taking symmetrical stride lengths front to back. The other benefit to something like this is that it is going to lengthen your step. One of the main deficits we see after a knee replacement is patients tend to take that short step. So we want to get them a little bit longer. We know short steps, shuffling gait, we know that's consistent with increased risk of falls. So as we can normalize your ambulation, normalize your walking, you're going to have better balance. You're going to have less chance of fall, less chance of catching your toe or tripping over something. The other part that I like, now some of them will have these reciprocal arms, some of them won't, but absolutely once you're on here, the same benefits apply to this as the elliptical, as a Stairmaster. Your feet never break contact with the pedal, so you don't have the shock absorption of walking or running or jogging or any of those things. You have a vertical component which helps improve muscle strength and function, but you also obviously have the cardio component. You have the reciprocal gait so that you're moving in more of a fluid motion. And what we're really doing is we're just kind of getting the body back to fluid movement, and that's hard after you've had surgery of really any kind, but especially after a knee replacement. Now, I love the fact that you're weight bearing, so we know that weight bearing is important for bone growth and bone health. There's just so many benefits to this. If I had to bring out what's the negative side of something like this. Now, first off, if you've had a single knee replacement, you might have significant osteoarthritis or other degenerative changes in your non-surgical knee. Something like this may be too aggressive for you at this point if you have a non-surgical knee that is going to get inflamed, and maybe this isn't the right device for you. Another thing that I'm not really a fan of here is the width between your feet. Now, this holds true for most things. A bicycle, the elliptical, the arc trainer. If you were to measure center of pedal to center of pedal on something like this, it's about 10 inches. Now, I don't normally walk with 10 inches between my feet. So it's going to alter the way my ankle, my knee, my hip, everything is working when I'm on this. And I want you to understand that this is not going to be the same as walking in the community. But I think it's a trade-off that I'm willing to accept for myself if I'm the one in your shoes right now. I'd rather get the benefits of this and deal with the wide base of support, as opposed to, you know, thinking, well, walking is the only thing I can do, but I can't get out and walk and I don't have enough space in my house. So all of that being said, let's jump on here for a second. Let me also kind of talk a little bit about positioning, getting on, getting off. So with a typical arc trainer like this, usually what we do is we step the non-surgical foot on the machine first, then we bring the surgical side up second. We'll usually just allow the client, and I'm kind of back here over my center of gravity. I allow the client to take these tiny 3-inch, 6-inch, 8-inch steps, really to build confidence and understand what the machine's going to do. I explain to everybody the machine is not a treadmill. It doesn't have power of its own that's going to make it go without you, but it is like a bicycle, and it will build speed and momentum that you might not be ready for. So the first lesson is you have to understand how to control the machine. You want to know what the machine's going to feel like. Then as you build confidence, as you build security in your ability to manage the machine, you're going to lengthen that stride so that you're taking nice long steps. Now if you guys can see it, I'm not sure if you can see it through the camera, if I keep my body back, I can barely flex the knee and stay on the machine and keep it going just like normal. But as I lean my body forward, even to the point where maybe I lean and grab the display, now I can get a lot more knee flexion in this position. So what's nice is I, as the user, can control how much or how little knee flexion I'm actually going to get. The other part is I've got the reciprocal push-pull of my arms. So when we're walking, normally if my left leg is going forward, my right hand is going forward, and then back. This is a walking pattern we've used as early as we've learned to walk. And so while I'm on the arc trainer, I've got my arms and legs moving in a reciprocal pattern, just like normal. Obviously, I can set the time, I can set the resistance, the elevation. As I progress clients here in the clinic, I will usually start them with less than they believe they can do. If they think they can do a minute or two, I might start them with 30 seconds, because we're not going to make changes in the muscle within the first couple workouts. So I'm not worried about that. I'm just trying to expose the tissue to the stress involved in the movement, and I want my client to feel what it's like, to build confidence, to get comfortable. Now, my initial goal is I build up to 10 minutes for most clients. Once we've reached that 10-minute mark and we're doing it consistently, then I'll start to manipulate resistance. I'll usually increase the resistance and reduce the duration. So maybe we go from a level 40 to a level 60, and we go from 10 minutes back down to 7 minutes. And then we go to 8 and 9 and 10, and once we've gotten back to 10, then what I'll do is I'll increase the elevation. Maybe from a default of 3, I'll go up to 6. I'll keep the resistance at 60, increase the elevation, bring my time, my duration back down to 7. 8, 9, 10, and then we just continue to manipulate. Maybe I manipulate the speed. Maybe I alter where they do a minute fast and a minute slow. Maybe they do a minute at high elevation, the step, and then a minute at almost flat. As long as we continue to bring variety, our bodies will continue to improve and adapt and change. And that's ultimately the goal of any workout, is to create enough of a response that your body has to adapt, not so much that we cause injury, and not so little that we don't cause that adaptation. All right, guys, as always, if this equipment review information is helpful, please show your support by subscribing to the channel, like this video, and let me know in the comments on YouTube what kind of content you would like to see produced, what kind of questions you would like to see answered. Guys, I appreciate your time. I'll catch you on the next video.